Hello, nice to meet you guys. So today we're going to talk about your son's hemophilia. So let's begin. So you might be wondering what hemophilia is. I'll explain to you what hemophilia is, so you can effectively understand what this disorder. Your son has a genetic disorder called hemophilia, where blood cannot clot properly, which can cause excessive bleeding after any damage done to the body. Unfortunately, there's no cure for this disorder, and it can last for years or lifelong. But we will go over the treatments later to help your son live the healthiest life he can. So you might be wondering what happens to his body. Some common symptoms of hemophilia patients include severe bruising, unexplained bleeding, and blood in the urine. Bleeding in the head is also a possibility, which can cause paralysis and seizures. Something that's very, very unlikely is death, which is caused by excessive bleeding in the vital organs. And some challenges your son may face with this disorder is bleeding in the joints, which is very common, which can cause joint pain and diseases. There's also severe limitations to the range of motion when you have hemophilia because can get when you move, it can give you chronic pain. So you might be wondering, what is the genetic cause of hemophilia? So hemophilia is an inherited disease which is X-linked and has a recessive pattern. Hemophilia is caused by the mutation in the F8 or F9 genes located on the X chromosome. Therefore, the mutated gene is unable to create or incorrectly produce the proper clotting proteins. Now I would like to discuss how your son may have inherited this disorder. First, it's important to know that the father has hemophilia and the mother does not, although the mother is a carrier of the disorder. In this Punnett square I've drawn, you can see the father's genotype X little hy and the mother's genotype X big H X little h. These will be used in the Punnett square to calculate the offspring. Not having hemophilia is a dominant trait, which also corresponds with the capital H, and having hemophilia is a recessive trait, which corresponds with the lowercase h. If we cross the genotypes of the parents, we would result in the genotypes of the offspring/children. So using the Punnett square, we can determine that the genotype of your affected child is X little hy, which is, since the phenotype is that he has hemophilia. We also know that he's male, because he has an X and a Y chromosome. With this Punnett square and the pedigree chart I've drawn to the left and right, I was able to determine that you were to have if you were to have another child, the probability that they will have hemophilia is 50%. That's something to consider. Since the trait for hemophilia is recessive, the only two ways the child can be hemophilic is if their genotypes are either X little h, or X little hy. Using the Punnett square and the pedigree chart, we can determine that your next child can have the genotypes X big H, X little h, X big Hy, and X little h, and X little hy. Out of these four genotypes, the X little hy and X little h genotypes are the only genotypes of your potential children to have hemophilia. Additionally, it's also important to understand how or how not your son would have inherited hemophilia. Your mother's phenotype is that she does not have hemophilia. Since the mother does not have hemophilia, she could either be a carrier or not have it at all. If she was not a carrier of hemophilia, there would be no possible way for your son to inherit this genetic disorder. But if your son was actually born as a daughter, there would be 100% chance that she would be a carrier, but she would not have hemophilia. So with Punnett squares, it's critical that we discuss meiosis and the law of segregation. The cells that result from meiosis are haploids, which means that they contain half the number of chromosomes of the diploid. When the sperm cell fertilizes an egg cell, the baby is made. Additionally, with a given Punnett square, the father's gamete X little h y and the mother's gamete X big H X little h are displayed on the top and sides of the Punnett square, as you can see. The when we cross all the display all, cross all the gametes on the Punnett square, it displays all the different genotypes and zygotes. The law of segregation states that every inheritable trait is controlled by a pair of alleles that are split when the gametes are made through meiosis, meaning that each gamete is assigned one allele at random. It is crucial to identify the potential lifestyles of your son. We can discuss what his education, employment, living ability, and ability to have children will be like. For your son will be able to have a normal education, but they'll need to be careful in halls to avoid any unnecessary contact. It is also important to agree that an agreement is made, such as extra time for testing or the ability to leave class without permission for medical reasons. With this disorder, like hemophilia, it is important to consider the job setting and activity level. Keep in mind not to having an engaging job that puts stress on your joints and has a high impact on your joints as well. People with hemophilia can live alone, but they just need to increase their personal responsibility and go to weekly doctor checkups. As people with hemophilia get older, then they need to be supported with a caregiver. People with hemophilia can have children, but there might be a chance that their children might have hemophilia. It's also important to discuss some long-term lifestyle segments. So the median life expectancy of a child with severe hemophilia is 63. Without proper treatment, people with this disorder may have an approximate life expectancy of 10 plus years under the average life expectancy. What health problems they will have? Uh, People with hemophilia might have seizures, common joint pain, and bleeding in organs. Medical care costs annually. Medication treatment can cost about 270 grand or greater. People with severe hemophilia can have a cost of 1 million to upwards. Caregiving needs. People with hemophilia can live independently. As people with this disorder age, they need when they become seniors, they'll need medical treatment or even a caregiver as well. So hemophilia is a serious disorder that may make you think not a lot is possible. This is why I would like to give a hand to Matthew, a successful young man who accomplished a lot already and still has more to accomplish. Matt was born normally with no complications, but their family knew that he would have hemophilia. During a surgery, Matthews developed an antibody called an inhibitor. This prevented the clotting factor treatments used to manage hemophilia. His mother was very upset and unprepared for her son's diagnosis of an inhibitor. Even though they tried everything they recommended to get rid of the inhibitor, nothing was helping. A lot of problems arose, such as they lost their health insurance several times because of the high cost of the treatment, and Matthew suffered bleeding after bleeding after bleeding. They spent weeks and months in the hospital as well. Eventually, Matthew did recover from this crisis. He has made best of his situation. Matt graduated from high school and with good grades, and he's now in college. He's also in a relationship, does daily things, and has a job. His mother says he's very intelligent, funny, and talented young man, which indeed he is. Matthew hopes to spread his story to many people and tell them a lot more about how he got through his situation. Thank you so much for your time. I hope I was able to give you insight about hemophilia. Please reach out to me if you have any additional questions.